Hello, I'm Dr. Daria Brzezinski, and you are watching What Wise Women Want, here on Charlottesville's Public Access Comcast Channel 13. Every week, we talk about topics that are relevant, we hope, to you, and will keep you informed. Ladies, we are 52% of the population with 85% of the purchasing power. Let's use that power to make informed choices for yourself, your family, and your community. You can find out about our programs and the panelists, our contact information on www.whatwisewomenwant.com. Remember, wise is spelled with a Z. That's www.whatwisewomenwant.com. Today, we're going to be speaking about, long title, the ramifications of ADD, ADHD, Autism, and Aspergers on young adults. What are we doing to prepare them for life and life skills? And we have a very diverse panel today. Our first to my right is Carter Lewis. Carter is an advocate for Ritalin awareness. To her right is Mary Margaret Hughes, who's a special education teacher with the Albemarle County Schools. And to her right is Naomi Akins, counselor and manager of the Department of Aging and Rehab Services. Welcome, ladies.
Thank you.
Thank you.
So we're going to be talking about, and the reason that I'm really wanting to do this topic is because I have clients who are who are young adults and autistic Asperger's high functioning. And I would like to really talk about the kinds of things that we're doing to prepare them for life and how we can do better. And so we have these various people here to be able to help us define all those things and perhaps help you if you are a parent of a child who has ADHD or autism, high-functioning autism or Asperger's, to be able to know what is available and what to do for your child. So, Naomi, why don't you start and tell us what it is that you do at the department, or what the Department of Rehab Services, because I think many people don't even know what it is.
Oh, that's very true.
Department of Aging and Rehab Services. What does that do? What is the function of it?
Well, the Division of Rehabilitative Services, which are in various field offices across the Commonwealth, we help people with disabilities to go to work. And relevant to this topic, we help young adults transition from high school out into the world of work. So our job is to help, number one, identify what's a good job. What's a job that's not going to make them fail because they have a disability. So we're always looking at where their strengths are, what their talents are, and what they really need to do to be successful. So there's certain environments or certain types of jobs. We all do better when we do something we both enjoy and do well. If we try to do something we don't enjoy and we don't do well, we fail. So that's basically what we do.
And you have a personal interest in this topic.
Yes. I also have a son with ADHD as well.
Okay. So, Mary Margaret, tell us a little bit about what you do at the Albemarle County Schools.
I am a teacher in the elementary functional skills classroom. So I teach a small group of 8 students with several other adults. I teach not just academics, but also social skills and what would be probably pre-vocational skills, such as following directions. The students that I have are typically the students with some more severe disabilities, but they do range in both skills and labels. I have some students with autism, but I also have students with intellectual disability, which is kind of a general category.
Okay. And Carter, why don't you tell us a little bit, you're coming from this from a different perspective. What's your perspective?
Yes, I was diagnosed with ADHD when I was 6 years old. And what I have found is that changing my diet has been the best possible thing for that. I feel that I have recovered by doing that. And I also feel like that I did not get the help and support in school in ways that would have been helpful growing up.
Okay. So, obviously this is going to be a very broad conversation because we really can't get into a whole lot of details, although I'd like to tell stories and things like that. We don't want to dull the audience out here. You've had a special needs child. You've been in the school system. So tell us a little bit about, and you're a teacher, and so tell us a little bit about, now I know being in the business world what we are looking for in hiring, and one of the other reasons why I want to do this program is because of the amount, the numbers of youths who are being labeled ADHD, autistic, Aspergers, who are now graduating and coming into the workforce, and what that means for them. I mean, you know what's offered through the school year, but what does it mean after they graduate? What happens to them after graduation? So, tell us a little bit, tell us what the school offers in terms of specific for a special needs child. I mean, does every student get a resource teacher? What kinds of things?
Well, the logistics of it are students are found eligible under a certain designation, and people call that a label. And so it's there's a primary disability, but there also could be a secondary and a tertiary disability. So based on that, budget is awarded a certain number of points per student based on their disability and the amount of support that they're going to need. So then we are staffed based off of that point system. So all of our students
give us a little idea what that means.
Okay, so for example, a student with autism receives 5 points.
Okay.
And so students who require fewer supports will get 3 points or 2 points or 1 point. And so
now the autism spectrum is vast.
It certainly is.
And so everyone on that spectrum gets a 5.
Most of them.
Okay.
Most of them.
Okay, good to know.
But depending on the support services that they need, again, it's a very individualized basis. So if it's a student who does have a lot of skills, then they may not require as many points because they don't require as many services. So then with that staffing, we decide how to break everything up. And so my classroom, I have the students with fewer skills who need to work on some of those filling in the gaps and things like that, the social skills, as well as some of the basic academic skills. So it's highly individualized. We decide based on what the student needs, whether it can just be an accommodation that's in the general education classroom, or whether it's a support or a service that requires being pulled into a therapy room or into a separate classroom. And even I would call my classroom a modified self-contained, because while most of my students do spend most of their academic time in my classroom, they also go out for all of the social time. So they start their day and they end their day with their typically developing peers, and they spend lunch and recess and all the specials with their homeroom. So they receive only the academics and the social skills training in my classroom.
So how many students do you normally have in a class?
I have 8.
8.
Maximum of 8.
Okay.
At our school right now, we have 45 IEPs.
Okay. And IEP is, tell people what that is.
Individualized education program. So that's what.
So it's an individual program for each child.
Right. The team develops with a student-centered approach where we invite the parents to participate in the writing and the development of the IEP, and we talk to the whole team, and we really kind of pull in the administrators and all of the
So students are tested for the IEP,
They are.
and they're given
tested
a battery of tests to find out what their skills are or what they
every
lack,
3 years. So they're found initially eligible based off of a battery of assessment tests, and there's a whole bunch of them out there that we use, and it depends on what we're looking at, what kind of skills the student has, and what their deficits are. So we look for those assessment tools that will best provide the most accurate picture of what the student can and cannot do. And so then we take that eligibility information and we devise the IEP. And so every 3 years we have to come back to the eligibility. We decide whether we want to retest or whether we revisit the old testing. So besides that, every 3 years with the triennial, we also every year update the present level, which is the biggest part of the IEP. So it's where you put in every detail you can think of, from classroom assessments to classroom observations, very specific about what they can and cannot do. And so that's
do you find those
year.
tests to be accurate in terms of determining exactly what the student needs? Do you find it relatively accurate?
It is most accurate and helpful for eligibility information. Now, typically what I will use more of the classroom observations and watching the student, what they are able to do and what they are not able to do. So as far as how much it advises my everyday teaching, not quite as much.
Okay. So in the Department of Rehab Services, sorry, I just shorten it for the time being to say that whole DARS or whatever. So what kinds of, do you test as well, or do you take the data that you get from the schools, or how do you determine?
It's a combination. A combination. We do take the information from the schools. It really depends on the type of disability and what we're seeing in the individual. So, for example, if for our program, there is an eligibility just like there is with the public schools. So we have to have a diagnosis, we have to have an idea of functional limitations, and we have to determine eligibility. Once we get past that, our focus is on how do we help that person get to that employment goal. And the biggest area that we see in most transitioning youth, not all, but most, is their self-esteem. Their self-esteem is in the toilet. You know, the whole social side of high school and middle school is tough. It's just tough. It's tough for every kid. And so depending on how well they've found their niche, how well their parents have supported good mental health and wellness and given them opportunities for successful activities that they like to do out of school. Depends on whether they have talents in other areas, music and sports. It really depends on every student. But self-esteem, you can't make a decision what your dream and goal is if you don't have a good self-esteem. So a lot of times we're trying to look at, okay, so this may be their diagnosis. They may have be somewhere on the spectrum with autism, but if their self-esteem is very, very low, they're not going to make good decisions. If they could be lower functioning, but have better self-esteem, and then it's easier to know how to direct them. It's easier to know what opportunities. And most of the time, it's getting an experience in the community, trying things, going to activities, working, volunteering, doing all the things out in the world that there are available so that you find the thing that makes you smile and laugh and feel good.
Right.
So yes, we do use testing because we're required. Federal dollars, follow the diagnosis, follow the testing, follow the whatever. So we do have obligation to do that. After that, it's how do we help counsel them and get them exposed to lots of different opportunities.
So Carter, as a student and now as an adult, were you tested, and what did the testing show?
I was tested outside of the school system by a private pediatrician.
How old were you?
I was 6 3/4, I think. It's the exact age. I was the youngest person in my class, that should be noted, and that's children who are diagnosed with ADHD. They did a study, and oftentimes it was the youngest child in the class. So I know that I looked back and kind of felt like, because I had a very bad experience with being put on medication, I feel like it stifled my growth as an individual, and I'm not talking about physical growth, I'm talking about socialization and so forth, and including also having some very detrimental after effects. So sometimes I wish, what if they just held me back a grade and maybe my socialization would have caught up with my age. And I just felt like in general the support for a child who's different or who maybe socializes differently. Like, I was an only child, I grew up on a farm, I didn't have peers or siblings to socialize with, so when I was obnoxious or didn't know when someone wanted me to stop talking to them or there's basic social skills. I was behind in my age, and I was behind in what I had been exposed to. So it would have been maybe more helpful than just putting me on a drug and hoping that would fix it would be to provide that socialization. So I think that is a very important component of helping these children.
And remind people what drug you were on?
I was put on Ritalin.
Okay. At age 6 until how old?
Until 18.
Okay. So thank you for that segue, because one of the issues that I'd like to talk about that I see with clients all the time is social skills. And as many, I personally do not like the labels myself with regards to defining a child's behavior, which is exactly what you're talking about here. I would much rather look at the whole child, see what's happening. We actually talked earlier before this programming started about recognizing youths who came into me who were suffering from fetal alcohol syndrome, and yet that is not something that is recognized as something to characterize in order to be able to get funding in the educational system, and which is really important if you're looking at the whole person. So let's talk about social skills. And what is typically, if we label somebody autistic, Asperger's, or ADHD or ADD, what would you say are the kinds of social skills that are deficient and need of help?
I have a lot to say on this one.
Go ahead.
Certainly social awareness, being able to read the situation, being able to read the social situation to know what to do. Because we take in thousands of details and our brain organizes it in a way that we can understand, and then we know how to respond. But for someone whose brain doesn't integrate all that information in the same way, they don't always know how to respond. So, really it's a lot of repetition and social stories on this is what you do if, this is what you do if, and then you practice it. So I recruit the whole staff at my school to say, this child's going to be working on saying, excuse me. So when you get the opportunity, kind of nudge into his way so he has the opportunity to practice that social skill. A very important one. It's much better to say excuse me than it is to push past someone. Mm-hmm. So, we take the social skills piece by piece by piece, and then we just try to put it all together by practicing with, at the elementary age, the community really is the rest of the school. Right. So that's our model. So we go to the rest of the school, we practice it in our classroom, and then we go to our community, the rest of the school, to practice it, both with children as well as with adults.
Mm-hmm. So, obviously does every school do this in the district? Breaking it down like this? Because it doesn't seem to me I get students who have this kind of skill.
I can't speak for the way other
so
teachers do it.
It's not necessarily a school-wide kind of thing. It's
a
district-wide?
Probably not. I don't know. It's going to vary with every teacher has their own style. Every teacher has their own idea of what's important.
Okay. So knowing how to read a situation is one of the social skills that these kids lack. And as you pointed out earlier, perhaps immaturity was a factor, and yet, here we are labeling these kids instead of teaching them or waiting for them. We don't have any patience in our society, waiting for them to catch up with that skill. I know I could list tons of skills. Naomi, can you name another skill, social skill?
Well, I think that the reading other people is probably the number one skill, but also making eye contact. Mm-hmm. That oftentimes if somebody doesn't make eye contact with you, you feel like they're not interested in what you're saying, you feel like they're ignoring you, and if you put that in a work setting, the boss gets upset.
Right.
Because they think you're ignoring them or being disrespectful. And so learning how to make eye contact, or at least short periods of eye contact where you're comfortable with that, is very, very important. The other thing is asking questions. If you don't understand what somebody else has said, you need to ask a question to get it clarified. So again, if I don't understand the instructions my boss has given me and I just go ahead with it, I'm going to make a mistake.
Right.
Mm-hmm. So then it's another failure opportunity, but being comfortable that it's okay to not know and it's okay to ask questions, which I think in our society is not very acceptable. I think, we're supposed to present as smart and
Right.
know everything. Well, we don't.
Right.
We need to learn. We need to ask questions. If more people would ask questions, I think our world would be a little better.
Well, some of the other skills that I've seen that students tend not to have, these types of students don't have, is, we all take for granted reading facial cues, for example, and they have no clue, what your facial cue is if you're upset or angry, or they just have no concept of what that is. And another one is jokes. I see it all the time, especially when they're in a work environment and somebody, for example, calls them lovingly a name, okay, that they did something on the job. And this happens a lot to males, I've discovered, who are in a working environment and they get a nickname for something they did that was maybe inappropriate, or, they didn't know what they were doing, like backing up a car and hitting a bumper or something of that nature. And they get, let's say a nickname, Crash. And so the special needs person takes it so seriously that, they're making fun of me and don't recognize that this is a bonding kind of thing among males, so to speak. So, we're just telling you small little snippets of the kinds of social skills that these individuals need, that they have been lacking, are in their life. Did you have, what kinds of social skills did they consider that you needed, that you were missing?
I guess other students found me obnoxious at times, and that I would, talk to them and not know when they weren't interested, and that's not something that's persisted. I mean, obviously, if I describe that symptom, it sounds like Asperger's, but it wasn't. It was an emotional and social immaturity, which I quickly grew out of, and I think that they viewed it as this really long-term thing. And as I said before, I didn't have siblings. I grew up on a farm. I was, experiencing peers for the first time and kind of getting to know what social interactions were like. And
you were experimenting.
Yes, and I think I was also a very intelligent child, and I think I would get excited about whatever my latest discovery was, and perhaps, to the exclusion of realizing that maybe someone else wasn't as interested. But that is something that I learned, and as most people did, and maybe I was a little later to learn that than some other children who grew up in a different setting. But it's not a long-term problem.
Well, when I take my Asperger's clients out, I take them out into public to see what their skills are or not. I find it interesting on how they will walk up to somebody and immediately start talking to them, and then not being able to read the fact that this person does not want to be, even though they're amiable and, wonderful and sweet and kind, and they just want to talk to them, and, oh, your daughter is really dressed nicely. They don't read the signal of the person who's saying, I want to be left alone, you're intruding on my space. So that issue is a boundary issue.
I just think we have to be careful imposing such a diagnosis on someone who's 6 versus someone who's 15 and still having that problem.
I agree. You're absolutely correct. And you also talked about asking questions. And one of the things that I see is they are taught to, when they go through the school system, this one particular person had teacher after teacher who said, ask questions if you don't understand. Well, this person got into a work environment and kept asking and asking and asking and asking, because he didn't get it. He was a tactile learner, and he didn't get it from an auditory visual place. And so, he made himself obnoxious and got fired. So, these are the kinds. How do you teach kids these, if they're missing all these social skills? What's the best way to teach them? Because frankly, I'm frustrated, and I don't particularly like sending them to Woodrow Wilson, where they have to relearn everything. What are the kinds of classes that life skills classes and anger management?
I don't think you should feel badly that students need to go to Woodrow Wilson. In many ways, it becomes a very normal experience for them, because when they go to Woodrow Wilson, every single student there has a disability.
Right.
And so for the first time in their life, they are with peers.
Yep. Exactly.
And the whole school is
Yep.
peers.
Yep.
So it would be nice that everyone got everything they needed before they turned a certain age, but between the needing more time to mature, not always having the right ability to learn things, having, the pressures of funding and everything else that we have going on right now, there's a really nice growth opportunity there. But the program you're referencing, the Life Skills program at Woodrow Wilson, focuses on social maturity, focuses on taking care of yourself, independent living, shopping, budgeting, everything that you need to be a fully functional adult in our community. And so it's a really cool program for our young adults to attend, because, again, they're not being compared to
normal folk.
Well,
quote unquote.
I don't like that word, but kids who may not have a disability.
Right.
So that, because normal to me, what's normal?
Exactly. There is no such thing.
And thank gosh we're all different.
Right.
I think being different is
Well, that's why I
part of
said
the
quote unquote.
pleasure of it. But they really do. For some of the students, it's the first time away from home. It's the first time, they have to make their beds. They have to get up at a certain time, so follow a schedule, do all their grooming, and they go through all the grooming stuff and all the different aspects of you. This is what you have to do if you want to live independently as an adult. And it's, a lot of times, when I think back of the first time I was on my own, I said, oh, this is a lot harder than I thought it was going to be. I still remember going, okay, I ran out of food here. How do I learn to stretch my food better so that I have food to eat? And what are the jobs I can pick up to help earn a little bit more money to make sure I pay the bills? Everybody has to learn some of these things.
Right.
And unfortunately, that's not necessarily a priority in our current school systems, which is sad. I mean, I don't know. I took home ec. I took shop.
Right.
I learned how to do recipes and cook. I learned how to sew. I learned how to decorate my house. I think there are a lot of things about that are important for everybody to know.
Life skills.
And the checking book thing, to me, should be a mandatory part of every student leaving school. My kids had it in 5th grade at Cale. They had a checkbook, and they got points, and they got to buy things, and it was the best lesson. 5th grade, they got that.
So are those the kinds, how do you teach these life skills? Because you have to really pinpoint them and separate them out little by little.
You do. And so, like I said, I recruit the entire staff. So one of the things that we do is we do some volunteering. So we collect box tops. So this year we collected box tops from all the grade levels. We counted them out, we cut them. So these were all functional skills for my students. They saw the project from beginning to end. It was one child's job to gather the box tops. It was another child's job to count them. It was another child's job to sort them. And so those kind of things, those are the context in which you practice those pre-vocational social skills, following directions, sticking to a task analysis. This is what I do first. This is what I do second. And being able to, you get a child to a place where they're able to do that in a routine way. And then you start to throw in problems. This isn't where it's supposed to be. How do you problem solve that to figure out what you do next? Because so then you try to make them a little more flexible with that routine. Another thing we do is we volunteer with the preschool class, and we feed them lunch. So we go to the cafeteria, we get their lunch, we portion it out. And so that, again, there's more pre-vocational skills. Not only are you interacting with my students are interacting with the little bitty kids, and so they get to feel a little bit of that pride of being the older student, and they're here volunteering, and then they get the organization, they lay out all their materials, and they set them out, and they have to count. And so it's just a matter of finding those elementary sized jobs to do. and then helping them build those skills to do them more successfully.
I have
and
to
then
tell
you start to fade back the support that they need. So then you
Right.
start to fade
Right.
back the adult
Right.
so that they can become more independent with that skill.
Well, Mary Margaret, I've been in a lot of schools, and you are an atypical teacher in this regard. Because did you have those kinds of experiences?
No, I mean, the school I went to was a regular private school. It wasn't a school that was attended to children with special needs. I mean, we did have, I suppose, exercises that dealt with sort of preparing children for money management, but they were more math related than life skill related, if that makes sense. So just in general, with special needs or not, I feel like the life skill aspect in schools is very much lacking, and I'm sure it would have been helpful to me and my peers, regardless of what they had going on.
Well, unfortunately, if you don't mind if I pipe in on that, unfortunately, my students are on an alternate assessment program. So it sounds like you went to private school, so every public school child has to take some sort of state assessment. Right. So it's the SOLs or it's the VAP, which is the Virginia Alternate Assessment Program. So that's the curriculum that my students are on. However, even though a child has a disability, they still have to pass one of those tests. And so the teachers are put under the same amount of pressure to teach those SOLs. And it doesn't leave a whole lot of room, unfortunately, for teaching those finer nuances of things. However, I think the pendulum is starting to swing more towards the maker movement, which incorporates a lot of those, that working together, the social problem solving, as well as the problem solving with your project. So it's working through a team dynamic, but it's also trying to solve, a problem to make your project work.
You are listening to What Wise Women Want on Charlottesville's Public Access Comcast Channel 13. I'm Dr. Daria Brzezinski, and today we're talking about, our panel is talking about the ramifications of education for ADHD, Asperger's, autistic young adults. And we have on our panel today a diverse group of people. To my right is Carter Lewis, who's an advocate for Ritalin awareness. To her right is Mary Margaret Hughes, who's a special education teacher at the Albemarle County Public Schools. And to her right is Naomi Aitken, who is a counselor manager for the Department of Aging and Rehab Services. So I have clients who, and I'm trying to stress the kinds of daily skills kinds of things, because it seems like this is what trip people up. So for example, I have a client who thinks that because he had a resource teacher his whole 12 years of going through school, that somebody's going to take him through a job and hold his hand and explain everything to him, and he's discovered after being fired twice that that's never going to happen. I have another one who was never, talk about taking tests. This person had never taken a time test. So his concept of time isn't equitable in a business situation. So if an employer says to him, you need to have this finished, he completely is oblivious to the time it's required. Again, has been fired from 3 different jobs. And their organizational skills, I think I have yet to meet one. You're really organized, but I have yet to meet one who I walk into their home and their home is organized in any respect in terms of being able to find anything. I mean, things are disheveled all over. It may not be dirty, but it's certainly not organized. So these old, and as far as budgeting and money goes, that's off the beaten track. So you didn't have a resource teacher, you weren't taught to budget your money, you had to learn all those things yourself?
Yeah, I mean, my mom taught me how to balance a checkbook, and I was just always I always kept an eye on my money, and I always really tried to just be aware of my spending. So it was just sort of a...
Where did you learn your organizational skills? Because you're very organized.
Oh, thank you. I just like having things organized, and it makes it easier to find something that I'm looking for. I guess it arose out of a desire to, okay, I'm looking for this particular thing, and I want to know exactly where it is. at all times. And so from that, just that desire, I guess, came the skill of just doing it.
One of the things about Carter is that she is extremely verbal for somebody who has been on Ritalin for so long. It's really unusual to find somebody who's articulate. And one of the reasons I think is, if you don't mind my telling people, is that her parents sent her to a talk therapist almost your whole life, and who gave her the opportunity to be able to speak. And so, that's how she's become an advocate, because most of the people I've ever met on Ritalin are definitely not as articulate or cogent in terms of being able to communicate. Do you find that to be true? Yes,
I do. I've only met, of all the people that I've met that have been on it, and everyone has a different experience. I'm not trying to put words in anyone's mouth, but everyone I've met was on it, save for one person says, I wish I'd never been on it, and they feel like it harmed them. And now I have one person who says that they feel like it helped, but that's one out of the very many that I've met.
Okay. So obviously not exactly the best solution. Let's talk about peers, working with, when we isolate these kids in an environment in a school, and even if we do put them with, people of their own kind of special needs, does it really help them to be able to be in the real world when they have to adjust to, people without special needs?
Well, it would have to be an individual case-by-case basis, for
what's
sure.
What's the benefit of isolating them as opposed to keeping them in a regular classroom?
The only reason I can think of is if the child with a disability has aggression.
Okay.
That's the only benefit I can think of. Other than the fact that to provide the services I need to academically, most of my students are very visual learners, so it's very materials intensive. We have lots of materials, we need lots of table space, we have to spread things out, we have work systems, and so it's not something that can be done in general education classroom, because these classrooms are busting at the seams, and there just isn't enough room for us there, and there isn't the ability to control the rest of the stimulus. So, classrooms are often loud, and there's lots of things going on, and so in order for my students to learn what they need to learn, it's best if we come into a quieter space. The space is organized in a way that they understand. It's very, very visual. We have lots of visual cues for everything, work systems, so that when I create not just the classroom environment but also their work, you have to answer a few questions. What am I being asked to do? You have to answer these non-verbally, so these have to be questions that they can answer in their head by looking at what you've laid in front of them. What am I being asked to do? How long will I have to do it? And what's coming next? And so if you keep those three questions in mind when you're creating the environment, students are going to feel calmer. My particular students are going to feel calmer, they're going to feel more centered, they're going to be able to learn better. Mm-hmm. And so that's why I teach most of my academics in the classroom outside of the general education classroom.
Okay, so does that help people who come to you in the Department of Rehab Services in terms of helping people to function in the work world?
It does when...
But we really don't really see
it does
this.
And it
this
doesn't.
Is an unusual teacher here.
Well, it does and it doesn't.
Really, this
Again,
is a really special person. Now I know why they sent me.
Part of what has to happen is you have to get from, I have this fabulous teacher who puts the materials and has the room organized and does whatever. How do I take that with me? Mm-hmm. How do I learn what I need and then ask for what I need so that I can be successful learning? So that's sort of the dilemma of as much as when you finish up a year, and I don't know how many years you have your students, but when you finish up your time with your student, you write up a very thorough, these are strategies that work, blah, 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 blah. It doesn't always guarantee that the next classroom or the next level, mm-hmm. they'll have that same kind of opportunity. And so it is really challenging. And again, it comes down to dollars and cents of what size of classroom, how can we integrate it. I mean, my philosophy is we need to improve education for all students, not just our special ed students. All students need better better teaching methods, better whatever, I don't know what you want to call it. I was enthralled at Cale because we were using core knowledge, which integrated the learning in all aspects. So social studies and math and English, everything was related to each other in the teaching process. To me, that was easier.
Which is life.
It was more realistic to learn that way. And so, that the unfortunate nature of SOLs is you're teaching to tests. And
right.
And there aren't jobs that give you tests.
Right.
So, it really doesn't help any of our students when what they need to do is be creative. They need to problem solve. They need to know, how do I learn best? How do I tell somebody else how I learn best?
Yep.
So how do I ask for the learning? If you would just demonstrate that to me, then I will be able to do it. Mm-hmm. If I have a list that says step 1, 2, and 3, so the smartphones have been just invaluable recently. We have a culture of we have to pay attention that, when you go into the workplace, you're not texting your friends or talking to your friends all day long. However, as an assistive technology device, somebody's doing work, they can use their smartphone, checklist, pictures. This is how it's supposed to look. When I put that Subway sub together, it's supposed to look this way. And I compare it to it.
Right.
These are the steps. This is what I'm supposed to ask. When I get stressed out, what are some helps?
Right.
There's so many apps out there that are stress management apps that I absolutely love, that I find invaluable. I need to go, what does Naomi need to do? Naomi needs to go for a walk. I need to deep breathe. I need to reframe. I need to go to my positive thinking place.
Right.
There are all sorts of different things, but everybody's different.
Right.
But if we don't help folks learn what is that I need and how do I express it?
And one of the things that, I'm dyslexic. And so, but in the days when I was going to school, there was no such thing. There was no such term. I would walk through glass doors because I didn't see them, and to this day, if I'm tired, I reverse numbers all the time. But the thing is that there was no special class for me. I had to learn how I learned and to be able to function in the world and do it, as best as I could by teaching myself coping skills and the other kinds of things. Granted, I didn't know how I learned. And so I developed coping skills, but by the time I got to college, that failed me because it worked in high school, but it didn't work when I got to college. And I had to relearn, how to study skills and things of that nature. Mm-hmm. So, I'm just trying to figure out, and we have this young lady here who didn't have special education or special teachers and has really, adapted and become a functioning, high-functioning person herself. So do we really need all this specialness in the classroom, or can we learn it, in regular classrooms rather than, and my other question is, which I think I want to ask first, is I'd really like to know how much money the school district gets per child that they identify as handicapped. Do you know what that is?
I don't, and I don't know that that's how it's allocated. I don't think it's per child. I honestly, I don't know anymore.
Well, they get per child $7,000 to $8,000, and I have been told by other school districts that they get, not in the state, but in other states, up to $150,000 a child. And I thought to myself, what better way to get more school funding than to keep identifying more and more of these kids as handicapped in order to be able to get more resources. And
you get dinged if you over-identify.
Sorry?
People are paying attention for over-identification.
They are.
It would really concern me with ADHD, though, because it can be such a gray area with age, and my diagnosis is so, I feel
nebulous.
Like I feel like in a lot of cases. So I guess that would concern me for approaching it that way. Like, what if children are, what if every boy child who is overly, hyperkinetic ends up with this diagnosis, so that more funds will come.
And what if, in fact, all they are is just being boys? and because boys tend to be more immature than reach maturation far slower than girls do. And what if all this is just developmental lag rather than identifying them as this thing or the other? And one of the problems that I find is that parents feel much more secure when their kid's labeled, so that they can say, okay, that's the problem, and it's like a badge of courage, that a badge that says, my kid, I have identified that's what his issue is, so therefore we'll drug him, and that's how we'll deal with it. But can you see that some of these kids that are coming into your classroom are in fact normal kids with just lagging maturation? Is there a way to identify that?
Well, look, it's observation. It's observation, and it's really being able to tease apart. What I think we're seeing a lot at my school is teachers misunderstanding the English as a second language piece as a need for special education.
Yep.
And so what you have to do is we work on kind of a tier system, and so it's to be most efficient. So the kids kind of filter through. There's tier 1 and tier 2 interventions that teachers are expected to apply within their classroom, within the general education classroom. If this doesn't work, try this. If this doesn't work, try this. So there are things that unfortunately it's a variable. That teacher who you have in the front of that classroom is a huge variable. It can it can tilt it towards a really positive way, or it can tilt it towards a very negative way. I'm fortunate to work with a wonderful group of very caring teachers. However, it is difficult when you're looking at a classroom of 25 students. It is very difficult with
SOLs and testing and all the other things that have to.
So much.
And I'm not judging teachers here. It's the system itself. I was in the Philadelphia school system, and you have to understand there's University of Pennsylvania, Temple. They've got all these universities that are drawing people from many countries. And their children, the graduate and PhD candidates, are in the school systems in the public schools. And I went around to these schools and discovered these kids were top in their class, but because they couldn't speak the language and didn't have the same cultural background, they were being all put in special ed classes. And I said, whoa, and the parents didn't understand what it was that was happening to their children. So, we have such a long way to go in terms of all this that we're doing here, and legislation, for example. I mean, you all talked about all the testing you have to do, and the hoops you have to jump through in order to be able to do this. Be honest, has legislation really helped in terms of how we are helping kids to be in the world with life skills? What has legislation done?
From my perspective, legislation has been extremely helpful, and knock on wood, it will continue to be. When someone leaves public school and become an adult, there are very few resources.
Yep.
There's very little funding. There's, you're sort of on your own. And so with our program, with vocational rehab, we're able to, based on our assessments and working with folks, if they are interested and capable of working, we're able to help them. And we have funding.
Right.
The problem is the funding's been level for however long. So, like right now, people have to have 3 or more significant barriers. And there are these people with 2 and 1 who we're not able to help.
Right.
And there are a lot of the folks that are out there sort of floundering. And it makes me very sad. We're very fortunate in Virginia. We have a very strong state support because it's a federal state match. In our state, we get more money than most other states do from the state. So we can draw down the maximum federal dollars. And that's a godsend. But that's taken a lot of our work with the legislators explaining this is what we're doing. Because if I put somebody to work, then they become taxpayers.
Exactly.
If I get them off benefits and we're not paying them Social Security, well, magic that.
Right.
So it really, it's one of those things. What we're facing right now with the legislation is being lumped in with other workforce programs. And the credential required to work for our agency as a counselor is a master's degree in rehabilitation counseling. And they're talking that they're going to eliminate that requirement, and they're going to make it so you could have a degree in business and work with adults with disabilities. Well, to me, that's very scary, given that we are trained in counseling, we're trained in disability, we're trained in
everything is being turned into a business.
And I'm like, there are some people who come from a business background who have very clearly learned what they've needed to learn about working with people with disabilities, but I'm not sure I would want your students working with me, not working with a business major. They need to be working with people who understand how to work with them, how to train, teach. I mean, we teach as much as we counsel.
Right. So talking about legislation, I mean, do you think that your hands have been tied in terms, I mean, this isn't just handicap legislation, this is also, generally in the public sector. I mean, we're really not helping kids when we're so strapped in all the testing, all the legislation, all the things, all the hoops that have to be jumped through. The kids are not the first priority here.
You'd be hard-pressed to find a teacher who doesn't completely agree.
Well, one of the things that I object about teaching is the fact that the United States can't make up its mind if they're professionals or public servants, because they make them be trained as professionals and then treat them like public servants. I mean, if anybody came into my office and tried to tell me how to run my practice, which is what they do in a classroom, instead if you're going to train a teacher, then let them do what they know how to do and not, constantly micromanage to the point of ridiculous. So,
if I may, I really like the Montessori system of learning, and I feel like that obviously this is Montessori is a private school, but I feel like they don't follow the system of having children reading by first grade. They start it later in third grade. You'd never have that in a public school system because of the SOLs and having to meet certain levels.
Exactly.
And for a child who's, it's all about them, and I can't speak to autism or some of the more significant disabilities, but I can speak to ADHD, and I know that for some children it's merely a delayed prefrontal cortex that does normalize. They've done MRI studies that this happens. And for these children, if they can just have a little bit more time to grasp the skill of reading, maybe they wouldn't be medicated. The big place where they medicate children is first grade and fifth grade. If they could just make it to third grade and attempt to read, and reading was a big thing for me. That was one of the things that got me medicated. And if they'd just given me a couple more years, who knows what would have happened. And so I really like that. I like the fact that Montessori is a tactile educational system, and I think that's really important for children who are tactile learners. So I think that by constraining ourselves with these SOLs, we're really not giving an opportunity for other learning styles or for some leeway for people who may have lighter levels of disability, I think.
And there's also the Waldorf schools, the Reggio Emilia schools, the democratic schools, the free schools. They're all the same. They don't teach reading in the early years. They teach tactile kinds of experiences because they believe children will learn. Their belief system, all of them are, children will learn no matter what, just give them the time. They learn language. They certainly can learn how to read and do other kinds of things, even if it's just by modeling behavior. And so you're right, that was a really good point. It's the system itself that is creating all of these children, that we're having to deal with. I think, the pharmaceutical industry and my particular profession have really done a disservice to our youths and our children. And my concern is when they get into the workforce, what is it going to be like when they've created these, drug addicted people for the rest of their lives? Carter's really great because she found her way out, but how many kids keep on, being on prescription drugs?
Yeah, I found that I couldn't socialize on the drugs. It was like I went from being overly social, like this relatively obnoxious child, to being so stifled and so nervous and so just like the drugs made me feel crazy. So I felt like so many thoughts were flying through my head so quickly that I couldn't really socialize. It wasn't until I got off that I figured out that I wasn't as crazy as I thought I was all these years on these drugs. And I do have a very rich social life now. So.
In the last few minutes we have here, is there something you would like to cover? I mean, I have 50 other things I'd like to talk about, but is there anything? I mean, I think I pretty much covered the kinds of things that I wanted to talk about, even though I know this is really much more in depth than we're only scratching the surface here. But is there anything you'd like to comment on that you'd like to bring to this conversation that perhaps we haven't covered yet?
Well, I definitely would. I think what's very hard is that schools are only this much of a child's life. So the family and the community have even a bigger role, and it puts a lot of pressure on families, it puts pressure on parents. But parents need to have an expectation of their child being successful and doing things.
Yeah.
Every parent can start by having their children be responsible, where they put their book bag, that they take their shoes off. Little children have responsibility. You have to. I don't care what functioning level your child is. You need to have your child be responsible. Because if you don't, then they become adults and they can't function. Yes. They have to learn it as early as possible. And that's why I love the farming community, because I don't care who you are, if you live on a farm, you have chores.
Yes.
And you have work.
Yes.
And that's a good ethic to have.
Yep.
But the best thing that a parent can do is have high expectations for their child. The higher your expectations, the higher your child's going to reach. So that's my little soapbox.
Well,
if parents have high expectations for their children, and let them fail.
Let them
fail. Let them try new things.
Yes.
And let them fail.
Yes.
Because life is about failure.
Yep.
I mean,
it's a stepping stone to success.
We all have failure, and then we learn how to do things better.
Yep.
We learn how to do them right. If we've never failed, then we don't know what that feels like. We don't know how to overcome it and problem solve. And we ultimately can't feel good about ourselves.
Okay. So thank you so much for all of your input. We have Carter Lewis, Mary Margaret Hughes, and Naomi Akins. And thank you so very much. You have been watching What Wise Women Want, the ramifications of education on our special needs kids and young adults. Please join us at www.whatwisewomenwant.com, and wise is spelled with a Z, and join us to find out how to contact these people, or to find out about other programs we will be having in the future and those that we've done in the past. Thank you very much for joining us. Please stay tuned and join us again next week. Thank you.